Hey, this is Brian again, and I'd like to ask you to do a favor. We can't do this work without people like you, so if you can, please like, share, subscribe, tell your friends about Bring Back the Porch.
I always wanted to help people. I think it started early with my grandfather, who was a first aider, and I saw the joy and the love he had for helping people. I think that was an early impression for me. In grade 6, grade 7, I started to think about how I could do that. And my father got transferred. He's with the railway. Transferred here. I met my now wife, Cynthia, and her dad was a chiropractor. So that was a very good introduction, those initial treatments with him. And that started me on a completely set journey. I've never looked back.
This episode of Bring Back the Porch brought to you by Bernie Leahy, River Street Realty. Let's get you home. Well, since we started doing this podcast, we've had the pleasure of speaking with several professionals in the wellness and health areas, including Dr. Heinrichs, pharmacist Ethan Swanson, Selena Simmons from the Medicine Hat Family Services, Dr. Babor, a psychologist, Tia Henricks and Sarah Clark from Mama Coach, and from the Sonari Center, Christina Johnson. And continuing in that vein today, I'm pleased to welcome my chiropractor, Dr. Don Smith.
Thank you so much.
Now, you and I have known each other for over 40 years. Well, you've known my back for over 40 years.
Right.
You've had my back for over 40 years.
True.
And I thought it'd be interesting to talk about the profession of chiropractic because it's evolved since you began. When did you start your training?
I started in 1976 is when I first graduated. And that's when I started in Medicine Hat here. And it's been a ride. It's been a great pleasure to see how we've evolved. If you look around the community, we've got chiropractors that use all kinds of different techniques, options. We have everything from, myofascial release to adjusting to motion stuff. And it's fun to see that evolve. And it's fun to see how chiropractic has gained foothold or helped in many areas with sports and different activities outside of the office. Yeah, so.
You started, you said in 1976, but how long of an education process was it before you could actually begin practicing?
It's a 4-year program before that, plus a couple of years pre. And so then you take your Canadian boards at the time. And so that was a bit of a journey. And then you get all ready, and I started with my father-in-law, Lawrence Bright, and who were later joined by Dr. Chris Bright, his daughter, and Ross MacArthur.
Mm-hmm. I remember those days.
Yep, and all four of us invaded three of us invaded his practice, and it was good. It was good.
Why did you want to be a chiropractor?
I always wanted to help people. I think it started early with my grandfather, who was a first aider, and I saw the joy and the love he had for helping people. I think that was an early impression for me. In grade 6, grade 7, I started to think about how I could do that. And my father got transferred. He's with the railway. Transferred here. I met my now wife, Cynthia, and her dad was a chiropractor. So that was a very good introduction, those initial treatments with him. And that started me on a completely set journey. I've never looked back.
Any regrets?
Not at all. In fact, the last, section of my practice life, it's been wonderful. I've really enjoyed it.
You had to take some of your training, I believe, in St. Louis. Is that
St. Louis is where I took my training, yes.
All of it?
All of it.
Okay.
Yeah.
So was that by choice or by necessity?
No, basically at the time, Canadian Memorial Chiropractic College in Toronto was relatively small, so it was either wait, and my father-in-law had graduated from Logan in St. Louis, and that was the choice. And once you start with a class, you tend to want to follow those colleagues all the way through. So,
what was the training like? How do they focus on certain things? Medicine or just the
Take
body?
your regular medicine courses, your pathology and hematology and all those kind of courses like that, and then they bring it into a more practical realm of clinic experience, ultimately public clinics that we had for the people around St. Louis, and then you just evolve from that point.
When you started, how was the profession of chiropractic looked upon?
It was looked upon. It varied. It was not well understood at times. I think that's like any other profession. What we needed were some of our distinguished people from the past here that had started the chiropractic profession. They were wonderful, and I just think it took time for people to get used to it. Patients certainly understood it very quickly. The other healthcare practitioners, it took longer.
Yeah, there was always that stigma, perhaps, that it was, I think, quackery was some of the words I heard. That, this is not really medicine. But
I think it's like a lot of truths. They're first ridiculed and then understood and then embraced. And I think that's what I've seen in the years of practice. I've seen that transition. The physicians we work with sport medicine in different areas are phenomenal. And I think that when you understand how chiropractic fits in any setting, it does work.
You have seen it evolve over the years. Could you point to maybe some of the biggest changes you've seen in your career?
I think the biggest changes is the acceptance by government organizations like compensation, the expansion of that, the realization that there's value in the service. We've seen different areas where chiropractors have worked with universities and different things through the years, and research projects. Chiropractic research in Canada is strong, and we've seen a lot of that.
I know you're also big into prevention, things that people can do to prevent back injuries.
I think the number one issue, and you can see it all around, is mobility. Mm-hmm. I think that whether you're a physiotherapist, occupational therapist, whatever, we need to start directing our attention to how we're not moving. Technology has caused us to be a lot more forward with cell phones and different things. So I think we see that understanding that, wait a minute, this is a lot more than just back pain. This is basically how are we functioning? How are we moving? And especially in the later years for our seniors.
That cell phone has definitely changed our posture.
Cell phones have really weakened our posture. Like if you look at athletes, a lot of kids are a lot of head forward. They're head forward, they're slumped forward. One of my exercises I do in the office is actually to take that cell phone, open your palm and come back over. You can change your posture completely doing that. And you'll see these kids that look kind of slumped, maybe 12, 13, 14, and yet when you do that exercise, they've got perfect posture. So we need to we're not going to take away technology, but we have to kind of balance it by, if you're working on forward, you have to strengthen the front of your body and go back. So a lot of my exercises now are not back exercises, they're front exercises.
Yeah, and you're a proponent of those exercises because you've given me quite a few to use over the years.
Absolutely. And you know what? Some of them are neurologically based where you got to think about, for example, you can't tighten two sides of the body at one time. You can't do a biceps muscle and the other side. So what happens is sometimes we'll have people that are tight along the sides of their legs, they're very tight, but the inside's doing nothing. It's like having a football team where not everybody comes to play. So balancing that off, and I think that's kind of one of the things, I know some physiotherapists that are doing that are really focused on movement and organizing all that.
Yeah. You work with athletes, and some of your clients come in, and have you seen injuries change over the years because of the way that the sports have evolved?
I've seen some. I've got an athlete now I'm following that I've seen him perform better. We have less injury. If they have an injury, they recover quickly. I think that's the case with not just chiropractic, but other professions as well. But basically in pro rodeo, when I first started with the Canadian Pro Rodeo Sport Medicine team, very few of those cowboys had any other care. In fact, some of them looked at our table and said, "What's that for?" It was that new to them. But as they got into it, we're finding that I think we can safely say that that's part of the reduction in injuries with professional rodeo. Yes, we have the injuries, we have the concussions. Ty Posabon, we have that sad situation where he took his life, but I think we have those things. But between protective vests and the stuff we're doing in terms of treatment, the entire team, it's fantastic.
Talk a little bit about that sports medicine team, how it came about and how you became part of it.
Sport medicine, Dexter Nelson and Dale Butterwick. Dale Butterwick was from the University of Calgary, athletic therapist, and Dexter Nelson from Mount Royal. And those two were going down the road doing these rodeos. And I first got attracted because I really liked the shirts. I thought they were cool shirts. And
you like the uniform.
I liked the uniform. I wanted to be part of that. And it took a year of bugging them. And we finally sat down in Calgary with Canadian Pro Rodeo, or Pro Rodeo Canada. And we agreed that, okay, we're going to expand this team to include chiropractic. We might as well include massage therapy. And Dexter Nelson said a really interesting thing. He said, it's not up to us to decide. Let's let the cowboys decide. A year later, that same individual said he wouldn't consider doing a rodeo without chiropractic and massage there. And that has not changed. We went from a very few rodeos to 235 performances last year and 65 members involved. We've got 4 truck and trailers. We've got physicians, orthopedic surgeons, athletic therapists, a whole realm of people, and we have another division in Manitoba now. So the team has really grown, expanded, and the big thing with that is in any group of athletes, they have to trust what you're doing. And in that situation, people say, isn't it crazy to treat bull riders and wouldn't you rather stay in your office? The reality is, if I'm in the infield treating a bull rider, it's not just me. It's a team of people.
And that is the key.
That's the key.
Yeah.
You are never alone. You have shoulder to shoulder. You might have an orthopedic surgeon right beside you. You can ask. You can share. And what we look for in the team, and I've been like 25 plus years on it, is basically what we look for is, are you comfortable enough to say, I can't figure this out. I need some help. Mm-hmm. That's the hallmark of how a practitioner gets on sport medicine. We need to trust that you're not going to try to do it yourself. Mm-hmm. It's really cool that way.
I would guess that when you first got into sport medicine with pro rodeo, that mindset of the cowboy was, I'm independent. I don't need any help.
Well, that's changed actually over the years. Yeah. After Ty Postbone passed, the saying now is, are you tough enough not to ride? So it used to be that we'd have to really work to convince. I remember Dr. Heemstra, orthopedic surgeon from Banff, we spent half an hour convincing this cowboy that if he rode, he'd end up in a wheelchair. It was a very serious situation. His biggest problem, he didn't want to go back in the bull riding room and say, I can't ride. Now, if you're having a bad day and you're a bull rider, it's okay to say, I can't do it. Mm-hmm. That's power. That's how things do change.
Yeah. Now, do you make the circuit with this team?
Yeah, I used to. We're assigned rodeos at the start of the year, so you get some days at Calgary Stampede. My favorite was Clooney Bull Riding, which is, 4 of us, 2 athletic therapists, massage, myself, and 2 paramedics and 25 or 30 of the best cowboys in the world. And there's going to be some injuries. Yeah. And you've got no hospital. You've got to use your head.
Yeah.
So everybody brings their best to the table. And
almost like a MASH unit.
It's great.
Yeah.
It's actually the true essence of team. In other words, we drop all the titles. When you're in a room when you're shoulder to shoulder in a room, you have to focus on, what can I bring to the table today? And the group, as a group, we say, what's the best thing that cowboy needs today, or cowgirl? That's our goal. It's about their performance, about getting them out there safely, and it's a team.
Is there a difference between, say, an injury that a bull rider might experience compared to a bareback rider or a saddle bronc rider, or even somebody jumping off a horse, steer wrestling?
Yeah, completely. You think about knee injuries with some of those folks that jump off a horse at X number of miles an hour. Barrel racers have multiple stresses, and some of the areas you think the bull riders get the worst, sometimes not. Sometimes our junior barrel racers have a tendency to be they haven't fallen enough to realize that you can't look at the big screen TV while you're still riding forward. But it comes from any area in there. And even Grand Entry, you hit another girl carrying a flag. We've had hand fractures, different things that occur. So
yeah. Now, you've also sort of run the gambit. You've gone to rodeo, but you've also gone to ballet.
Ballet, yes. Deb McLeod and I started. She's a physiotherapist here, well known, and we started the college. Her background was hockey, and mine was rodeo. And the directors initially thought that we were a couple of odd people to be involved, but yeah, it evolved from the college to the Esplanade. And the reason we got involved is because Alberta Ballet requires a chiro and a physio to be on site. And it's the same way I got into doing shows at the Stampede. And that's the same thing, is that the Doobie Brothers required a chiropractor to be present. And that was the door that opened. And but yeah, with the ballet, it's some of the hardest treatments I do is ballet.
Why?
Just because they're incredibly flexible, and you've got to find that weak spot. So you actually have to, the way you find it is you have to put them in the position on stage. You have to put them in that actual dance position that causes the injury to find it. It's really a challenge. Yeah, they're very interesting to work with.
Okay, and you're also involved in touring other medical facilities. You've gone, I think, on flights with STARS.
I did STARS. I had this desire to understand the other side, which is when you're a chiropractor and in the early years being kind of on the outside, I want to understand what it means to be in a trauma unit, what it means to be. So Royal University Hospital in Saskatoon, spent some time there. Royal Alex, great experience. I understood what gridlock looked like when you have paramedics waiting in the hall and why that occurs and how stressful it is for two doctors to run that whole show. It's amazing. And STARS, I talked my way into there with Dr. Powell at the time. He thought I was out of the loop for that kind of thing, but I convinced him that, with rodeo, you do drop in and pick up some of our cowboys. And that was a good experience. We had a severely injured patient in Lethbridge, and got to ride along with the flight paramedic and the nurse. And it was interesting to see that collaboration and strength of the trauma team every 10 minutes as we're heading back, and see that all in action when I hit the ground. So it was really good. Now,
when you're rubbing shoulders with those professionals, it's also a chance for you to tell them a little bit about chiropractic that maybe they don't know.
It is. For example, Calgary Stampede again this year, our association puts on a luncheon, and the highlight of the luncheons, we get to take these healthcare people and medical people down behind the chutes in Calgary, which is a rare experience. And it's about chiropractic, but I really want them to see how chiropractic fits in this whole thing. So they get to see people getting worked on during the Stampede, before the Stampede, which is 2 hours before. And it's an incredible experience to see the team in action. It's really interesting. So I like to do that stuff.
Do you get to mentor young chiropractors?
We do. We encourage people to come out and take a look at the team. We have a probation period. So basically, we want to know, are you comfortable? If something goes badly in the infield, I know I took someone along to a PBR, and the third cowboy out went straight down in his C-spine, and it's one of our worst injuries we've had. It took a while to get him out of there. That probably finished her. She's a very good practitioner, but it's just that kind of thing that you want to make sure that people are comfortable. If they're not, awesome, we'll refer them to your office, but some people don't like that first scene. And
yeah. You also work with Steve Sanderson, who is a massage
therapist.
Yes,
very good massage therapist.
And you are a team in that office. I know you talk about my various little problems, and you have helped me immensely, and you can do that for others too.
We do, and for me, it's always about collaboration. It's always about, hey, what do you think about this? I think you put your ego to the side and you just say, hey, what's good for this person? And I think the combination of massage and chiropractic is incredible. Timing sometimes before, sometimes after, but it does work.
And people shouldn't necessarily wait until they've got an injury.
No, in fact, the patients I see on a regular basis, I do see a certain percentage of my practice I see monthly, and they tend to have less sickness, less stuff going on. We can get them out of injuries faster. I'm okay both ways. I'll have the guy that comes in once a year with an acute injury. Those are tough. With rodeo, the beauty of that is I can recognize if they carry someone in and they can't move their pelvis forward, it's fractured, just send them to hospital. So you in a much quicker way, I don't panic with pain, but I can recognize what not to treat.
Okay.
That's probably the biggest thing.
There was a time, I think, when you as a chiropractor could not order x-rays. Has that changed?
Just a short time during COVID, where we couldn't really get together with government to actually talk about that. But I think so it required us to send a note to the physician and explain why we want the films. And I think that became kind of cumbersome for the physicians and involved multiple visits. They'd have to go to the physician and go back after. So you get 4 visits out of really when you don't need it. And the government has changed that back. we're all careful ordering x-rays. You have to have a good reason to order x-rays, but I think it's working out.
What do you think the future of your profession is?
I think it's good. I know that with Primary Care Alberta, with some of the initiatives that our association's doing, we're sitting on the table, and I guess my drive is for them to really understand what team means. You can talk about team, but do you really know what a team is? Do you really know how you involve all the players? So I think we're getting more ingrained in the system and contributing at a higher level.
Well, it looks like you'll be seeing me on a regular basis.
There you go.
I'm always in need of care, and you have provided great care to me over the last 40 years and hopefully another 40.
There you go.
All right. Don Smith, thank you for the visit.
Thank you so much.
Hey, this is Brian again, and I'd like to ask you to do a favor. We can't do this work without people like you, so if you can, please like, share, subscribe, and tell your friends about Bring Back the Porch.